Welcome to your IELTS vocabulary practice. You'll hear 25 questions. Each question comes with 4 options. Take your time, pause whenever you like, and try to choose your answer before the correct one is shown. Enjoy your quiz. Question 1. What is the meaning of assault? Option A. Quiet and respectful disagreement. Option B. Formal and structured debate. Option C. Violent physical or verbal attack. Option D. Peaceful and constructive exchange. Correct answer, option C. The correct meaning of assault is violent physical or verbal attack. Example: the community launched a determined assault on the rising rates of preventable illness through education and outreach. Question 2. What is the meaning of reef? Option A. Floating island of sand in a shallow sea. Option B. Ridge of rock or coral beneath the ocean surface. Option C. Raised coastal cliff overlooking open water. Option D. Deep underwater trench in the ocean floor. Correct answer, option B. The correct meaning of reef is ridge of rock or coral beneath the ocean surface. Example: the health team studied how damage to the reef was affecting the nutrition and livelihoods of the fishing community. Question 3. What is the meaning of cancellation? Option A. Procedure for modifying existing arrangements. Option B. Process of confirming a future event. Option C. Act of deciding something will not occur. Option D. Method of rescheduling a postponed event. Correct answer, option C. The correct meaning of cancellation is act of deciding something will not occur. Example: the cancellation of the flight left many passengers searching for alternative ways to reach their destinations. Question 4. What is the meaning of reptile? Option A. A cold-blooded smooth-skinned amphibian. Option B. A warm-blooded fur-covered mammal. Option C. A warm-blooded feathered vertebrate animal. Option D. A cold-blooded scaly vertebrate animal. Correct answer, option D. The correct meaning of reptile is a cold-blooded scaly vertebrate animal. Example: the nature guide showed the group a harmless local reptile during the educational walk through the nature reserve. Question 5. What is the meaning of preference? Option A. Reluctance to express any personal choice. Option B. Complete indifference toward all options. Option C. Greater liking for one option over another. Option D. Equal appreciation of all available options. Correct answer, option C. The correct meaning of preference is greater liking for one option over another. Example: she respected each patient's treatment preference while also ensuring they had all the information needed to decide wisely. Question 6. What is the meaning of abundant? Option A. Carefully measured and strictly rationed. Option B. Present only in very small doses. Option C. Existing in very large, plentiful amounts. Option D. Completely unavailable or entirely scarce. Correct answer, option C. The correct meaning of abundant is existing in very large, plentiful amounts. Example: clean water is abundant in this region thanks to decades of dedicated environmental conservation. Question 7. What is the meaning of conventional? Option A. Avoiding all established social practices. Option B. Replacing tradition with entirely new approaches. Option C. Following accepted traditional practices. Option D. Challenging established norms and expectations. Correct answer, Option C. The correct meaning of conventional is following accepted traditional practices. Example: the conventional treatment worked well for most patients, but new research was opening doors to more targeted approaches. Question 8. What is the meaning of anticipation? Option A. Feeling of excitement about what is coming. Option B. Feeling of sadness about a missed opportunity. Option C. Feeling of indifference toward upcoming events. Option D. Feeling of relief that something has passed. Correct answer, Option A. The correct meaning of anticipation is feeling of excitement about what is coming. Example: the children waited in happy anticipation for the start of the school's first ever community science fair. Question 9. What is the meaning of extraordinary? Option A. Perfectly ordinary and entirely expected. Option B. Going well beyond what is ordinary. Option C. Slightly above the usual standard. Option D. Barely meeting the minimum requirement. Correct answer, Option B. The correct meaning of extraordinary is going well beyond what is ordinary. Example: the extraordinary dedication of the community health workers during the crisis inspired the entire nation. Question 10. What is the meaning of peer? Option A. Glance briefly before turning away. Option B. Overlook something at a distance. Option C. Look closely at something or an equal in status. Option D. Look away from something without interest. Correct answer, Option C. The correct meaning of peer is look closely at something or an equal in status. Example: the senior nurse encouraged the junior staff to peer review each other's documentation to maintain accuracy and quality. Question 11. What is the meaning of philosophy? Option A. Examination of historical events and their causes. Option B. Study of fundamental questions about life. Option C. Study of physical matter and its properties. Option D. Analysis of language and communication systems. Correct answer, Option B. The correct meaning of philosophy is study of fundamental questions about life. Example: her philosophy of care was simple. Treat every patient as you would wish a loved one to be treated. Question 12. What is the meaning of avenge? Option A. To seek justice for a past wrong. Option B. To ignore and move on without action. Option C. To celebrate the resolution of a conflict. Option D. To forgive and release a past grievance. Correct answer, Option A. The correct meaning of avenge is to seek justice for a past wrong. Example: in many ancient stories, heroes would avenge the suffering of their communities to restore peace and justice. Question 13. What is the meaning of controversy? Option A. Brief exchange of views without lasting dispute. Option B. Calm discussion reaching an agreed conclusion. Option C. Quick resolution of a disagreement by all parties. Option D. Prolonged public disagreement on an issue. Correct answer, Option D. The correct meaning of controversy is prolonged public disagreement on an issue. Example: the controversy surrounding the new treatment faded once independent studies confirmed its safety and effectiveness. Question 14. What is the meaning of herb? Option A. A synthetic compound used in medicine. Option B. A mineral used for health treatments. Option C. An animal product used in traditional healing. Option D. A plant used for food or medicine. Correct answer, Option D. The correct meaning of herb is a plant used for food or medicine. Example: fresh basil is a wonderful herb that adds rich flavor to meals while offering gentle antioxidant health benefits. Question 15. What is the meaning of promote? Option A: to evaluate without making any recommendation. Option B: to support and encourage something actively. Option C: to observe without any encouragement. Option D: to discourage and actively suppress something. Correct answer: Option B. The correct meaning of promote is to support and encourage something actively. Example: the campaign worked to promote physical activity as a joyful and accessible part of everyday life for all residents. Question 16. What is the meaning of characterize? Option A: describe the typical features of something. Option B: list the historical origins of something. Option C: measure the exact dimensions of something. Option D: compare two things to find their differences. Correct answer: Option A. The correct meaning of characterize is describe the typical features of something. Example: scientists use specific markers to characterize bacteria and determine the most effective treatment for each infection. Question 17. What is the meaning of ambiguity? Option A: state of being entirely false and misleading. Option B: state of being too simple to misunderstand. Option C: state of being perfectly clear and precise. Option D: state of having more than one meaning. Correct answer: Option D. The correct meaning of ambiguity is state of having more than one meaning. Example: the ambiguity in the health guidelines caused confusion among residents who were trying to follow the advice. Question 18. What is the meaning of require? Option A: to need something as essential. Option B: to observe without needing anything. Option C: to find something entirely unnecessary. Option D: to evaluate without determining necessity. Correct answer: Option A. The correct meaning of require is to need something as essential. Example: recovering from surgery may require adequate rest, nutritious food, and emotional support from those closest to you. Question 19. What is the meaning of squat? Option A: to stand on one's toes at full height. Option B: to lie completely flat on the floor. Option C: to lean against a wall for support. Option D: to sit on one's heels or a lower stance. Correct answer: Option D. The correct meaning of squat is to sit on one's heels or a lower stance. Example: the physiotherapist demonstrated how a proper squat strengthens the leg muscles and protects the knees when done correctly. Question 20. What is the meaning of communicate? Option A: share information with others effectively. Option B: collect information without sharing it further. Option C: store information for future personal use. Option D: keep information private from all others. Correct answer: Option A. The correct meaning of communicate is share information with others effectively. Example: healthcare workers must communicate clearly with patients to ensure that everyone understands their diagnosis and treatment plan. Question 21. What is the meaning of proceed? Option A: continue or begin a course of action. Option B: abandon an action before it has begun. Option C: stop and refuse to continue an action. Option D: pause indefinitely before resuming an action. Correct answer: Option A. The correct meaning of proceed is continue or begin a course of action. Example: the doctor waited until consent was obtained before proceeding to explain the details of the proposed treatment plan. Question 22. What is the meaning of basement? Option A: small enclosed space above a ceiling. Option B: top floor directly below the roof. Option C: lowest floor beneath a building. Option D: side room attached to a garage. Correct answer: Option C. The correct meaning of basement is lowest floor beneath a building. Example: the family converted their basement into a cozy reading room filled with bookshelves and comfortable chairs. Question 23. What is the meaning of pitcher? Option A: sealed container for storing dry goods. Option B: container with a handle for pouring liquid. Option C: narrow tube used for transferring liquids. Option D: flat tray used for serving food and drinks. Correct answer: Option B. The correct meaning of pitcher is container with a handle for pouring liquid. Example: she filled the pitcher with cold water and placed it on the table for patients to help themselves during the long wait. Question 24. What is the meaning of obscure? Option A: exactly as familiar as most other things. Option B: moderately known within a specific community. Option C: not well known or difficult to understand. Option D: very well known and easy to understand. Correct answer: Option C. The correct meaning of obscure is not well known or difficult to understand. Example: the diagnosis was initially obscure, but further investigation eventually revealed a rare but treatable underlying condition. Question 25. What is the meaning of predominant? Option A: occasionally present without any particular influence. Option B: present as the weakest or least significant. Option C: equal in importance to all other elements. Option D: present as the strongest or main element. Correct answer: Option D. The correct meaning of predominant is present as the strongest or main element. Example: respiratory illnesses were the predominant cause of clinic visits during the cold and damp winter months. This is the end of part 43. See you in the next quiz.